We are now starting several clinical trials with NK CAR cell therapies, and we are using mainly a bioreactor called Clinimac Prodigy, and we have adapted this production to use this machine to produce the NK CAR, and we are using mainly allogeneic CAR T cells from cord blood, and we are using several cytokines like interleukin 2 and 15, and also we are using some molecules that can improve the survival of the NK cell, because the NK cells are very difficult to culture in vitro.